Hello and welcome. I'm Dr. Jill Wener. I'm a former hospitalist and now I'm an expert in physician wellness and a person who is striving to become a better advocate against racism. And I'm really have been fascinated with learning more about how COVID has been affecting people who are marginalized in our society, in particular Black communities, but there are other communities as well. And using this as a platform to help people understand some of the issues going on in our country before and now during COVID. And I have Dr. Nicole Rochester here, who is an amazing health advocate, pediatrician, and has all these wonderful navigator nuggets and all these great things that I'll let her tell you about that she does. So Nicole, welcome. Thank you so much for being here. I saw one of her, we're connected on social media, but I saw one of her incredible videos on LinkedIn and knew I had to interview her and get more of her knowledge and expertise. So thank you for joining. If you could tell us a little bit about what you do, your interest in healthcare disparities, and yeah, we'll start with that.
Sure. Well, first, thank you for having me, and thank you for creating this platform. I think it's really important that we all join in this fight to kind of highlight disparities. So I am Dr. Nicole Rochester. As you stated, I am a board-certified pediatrician, and I left clinical medicine in 2017 to become an independent health advocate. And that was a journey that was really inspired by my caregiving experiences. I was a caregiver to my late dad for about 3 years and really was kind of floored by the complexity of our healthcare system and how patients, particularly elderly patients, are treated in our healthcare system. And I just became intimately familiar with all the barriers that exist in the system. And so after after he passed away and I reflected on how many times I was able to get things done for him simply because of my experience, my knowledge, my title, my influence. I felt compelled to turn that around and use that information and that experience to help others. So I am the CEO of a company called Your GPS Doc, where I primarily work with family caregivers to help them get the care that their loved ones need. And when it relates to healthcare disparities, I've been interested in this honestly since medical school. And I just remember back in the 90s, and yes, I went to medical school in the 90s. We had all of these professors that would just come in and share all of this grim data about diabetes and about heart disease and about, cancer and pretty much every disease, and how African Americans had 2 times the rate of this and 3 times the rate of that. But there was never any context. And, it almost was kind of this implication like we were biologically inferior, or that there were things that we were doing to ourselves that were causing these differences in outcomes. And then I'll never forget, we had this professor that came and talked about like teen pregnancy and she just was so disparaging toward African Americans. And so I'm a little bit of a rebel. And so after her lecture, I was like really angry and gathered up some of my classmates of color and some white classmates. And, we drafted this like letter and we met with the dean, and, that led to a whole lot of other changes. And so I've been interested in this topic for a long time. And like you and I spoke offline, the COVID-19 pandemic and how it's playing out in communities of color was not a surprise to me or to you or to many people, but it has been fascinating to watch how the country seems to have been shocked by this. And so, I did recently talk about that on my weekly Facebook Live show, and just really trying to raise awareness, but also provide solutions.
Mm-hmm. Yeah, that's so powerful. I love that story. And I shudder to think, like, looking back at the ways I perpetuated racism, systemic racism in the healthcare system, and the way I interacted with patients. No, never overt, coming
Yes.
from me at least, but the bias and stuff like that. And I look back, I have this online course I offer about bias, and I just like, I use so many of my own personal examples of my interactions in the healthcare system. And so I'm so grateful that you were a rebel and spoke up, and I'm glad that you were able to make some changes. And I wish I could go back in time for many reasons, but this would be one of them where I wish I could kind of revisit from this lens. So I'd love to know from your perspective, because the data came out, like, yeah, just like you're saying, the data came out, I believe it was a week ago,
Yeah, about a week
almost
ago.
today. And I remember thinking, we started hearing stuff about, for people staying at home, if they're in a violent situation, if they're, around substance abusers or whatever, but we weren't hearing anything. Do
Mm-hmm.
you have any conjectures on why data about race wasn't released? Do you think that was totally just oversight, or you think people were too busy, like stamping out disease, or what do you think it?
Yeah, it's a great question. Honestly, it's something I haven't thought a lot about. There's a part of me that always wants to believe the best about people, and I'm generally an optimist at heart. But when it comes to this topic, and if you think back to just the history of our healthcare system and racism and disparities, part of me definitely believes that it may have been intentionally hid. And I remember that there were activists requesting this information, many weeks before it was finally released. And there were all kinds of excuses as to why we weren't being given access. And, I read an article the other day that stated that, race and ethnicity, like this data is on death certificates. So it's hard to believe that it wasn't easily and readily available prior to a week ago. So I can't speak for why it wasn't released. I'm glad that it was finally released. I think there's probably it's probably multifactorial. And like
Right.
you said,
Yeah.
people are stamping out disease, but because that information is so readily available, there's a part of me that wonders why, if it was intentionally suppressed
Or just like
or not felt to be important.
white gaze, not knowing that we would need to pay attention to that, almost like just
Yeah.
assuming that it is, not even anticipating that it would be something to think about or ask. I don't know. It's
Yeah,
very,
or they saw it and thought, okay, like, yeah, more Black people are dying, and
yeah,
like,
sure. It's really complicated. And no one has the answers. I've just always been very curious about that. So your approach to health advocacy, I love. It's very centered on the patient and their caregiver. And I wonder if you could talk a little bit about some of the struggles you've seen pre-COVID. You talked about it a little bit with your father, and I'm sorry to hear about your loss.
thank
I
you.
love how you've turned it into something so positive. A little bit about what the barriers might be pre-COVID, because again, these issues are being brought to light by COVID, but are not new. And what you think, how COVID has, because you're not clinical either, as I am not,
Mhm.
how you think that from what you've heard and seen from people who are still working clinically, how that's playing out now in COVID.
Yeah, I think, pre-COVID, what I saw frequently with my dad and many other members of my family, other friends, and my clients now, but as it relates to healthcare disparities and just our healthcare system in general, is that, our healthcare system is incredibly complicated. And, you see, I've seen in many of our physician Facebook groups, doctors who say, my mom is in the hospital, or my aunt, or whoever. And they're flabbergasted by how difficult it is, even for those of us who are intimately familiar with the system and with the medical terminology. So I think a lot of the barriers that I have seen, one, just come with knowledge, and it's not just the knowledge of what is diabetes, what is high blood pressure. It's really, how do you navigate that? And when you have these conditions, how do you get the care that you need within a system that is incredibly biased, that's incredibly complicated? And so, what I found when I was advocating and caring for my dad is that there's just a lot that the average layperson doesn't know.
Mm-hmm.
They don't understand a lot of times the complexities of health insurance, and they don't understand, that they really have a voice in the medical team. Many people don't realize that there are multiple ways to treat conditions, that doctors, we are biased, and I'm not talking about racial bias now, but depending on where you trained, where you did medical school, where you did your residency, you are biased as to how you even approach certain conditions. There's certain medications that doctors may just routinely prescribe. And so as patients and as caregivers, we don't realize often that there are other ways to treat a condition. So for an example, if you are going to the doctor for a particular problem and maybe they've prescribed a medication and you're having lots of side effects, most patients don't even realize that there may be 5 other medications that could treat that condition.
Yeah.
And maybe you don't have to suffer from those 3, 4, side effects. And so they'll just suffer through it, or they'll stop taking their medication. Then they get labeled as non-compliant. That's a whole nother discussion. But they don't feel empowered, in that visit to say, hey, doctor, I'm having this problem and this problem and this problem. Could this be a result of that medication that you started me on last month? Are there any other options? And just engaging in dialogue, even saying, okay, you want me to have this particular test, or you want me to have this surgery. What are my options? Generally the default is just to say, okay. And, knowing that appointment times are shortened, there's the dialogue that really needs to happen is just not occurring. And so most patients and their caregivers don't even know that they should be having those conversations. They don't know that they should be asking questions, that they should be, maybe pushing back, that if they don't understand something, it's okay to say, could you repeat that? I didn't understand that. They know that the doctors are rushed, and they know that, they are focused on so many other things. And so there's like this desire to be polite and this desire to not be a nuisance and to not be a bother. But as a result of that, many people are not receiving the care that they deserve.
That's so powerful. I'm just like thinking about all these people on ventilators now who aren't allowed to have visitors.
Oh my gosh.
And now realizing, looking back, that like 5 to 1 are probably Black patients, you know what I mean? Or some ridiculous. And so can you talk about, I'm like about to start crying. Can you talk about now COVID, like add 18 billion levels of complexity and isolation. And the doctors are, I think, doing an amazing job. They're doing the best they can. And like, but how do people advocate for themselves without having anybody there?
Yeah.
And while being so sick. Can you talk to that a little bit?
Yeah. That is really, I cried or almost cry when I think about it too, because I think about, there were so many times when I was at my dad's bedside and there were mistakes that were made, or near mistakes, near misses. He was allergic to aspirin, but yet he would frequently present with chest pain. So can I tell you how many times I had to say, stop, don't give him aspirin, despite the big red band on his wrist, and just times when I would, push back or question things that weren't being done, things that should have been done. And so to know that, these patients are in the hospital or presenting for care and they don't have someone else that can advocate for them. And to know that, when you are sick, particularly with COVID, you're short of breath, you're literally afraid for your life. And we know that when you're under stress, you are not taking in all the information that is being shared, and those are the times when you really need that third party to write down what the doctor is saying, to, talk about it later. And so it really pains me and it scares me to know that patients are suffering without the ability to have a family member or some other advocate at their bedside. And so, what I am telling all of my clients, friends, family members, anybody that will listen, is that, you have to learn how to do that remotely. And so, those phone calls, even at least daily, if not 2 or 3 times a day, to the nurse's station, trying to get that doctor on the phone, even if it's just for a minute or two, to get those updates, making sure that when the patient is first hospitalized, that someone in that family who knows that person well is calling and making sure that the medical team has a list of their medical problems, their medications,
Hmm.
the surgeries, that critical history that may impact how that patient is treated, whether they're considered high risk versus low risk. That information is incredibly important. And I think in many cases, it's lacking, particularly if the patient presents already in extremis. Normally somebody would follow behind them in the car, and they would be at the bedside and they'd be updating the doctors. But, now they don't have that ability. So we can't just give that up, though. I mean, we still have to use the other means of communication. We have to make those phone calls and emails and really do everything that we can to continue to advocate for our loved ones, in spite of the fact that we can't be there in person.
I wonder, I'm just thinking now they should be like additional staff at the hospitals to make these
Absolutely.
calls. So that, like, I wonder if that's something that they're doing. And I'm almost wondering if that's something that I could help with, making phone
They
calls.
are. So one of my great aunts was actually she's been hospitalized, or had been hospitalized for about 2 weeks, just came home yesterday for a non-COVID problem. But, we got to experience how does this work when you have a family member in the hospital? And I can say in the facility where she was, they were employing, people who, like some of the physical therapy. My uncle got a call from the physical therapist, just giving an update. And of course, it was a little frustrating because when we would ask more medical questions, they were like, well, I don't know that part. I was just asked to call you and give you an update. But then that person would pass on our questions to the nurse or to the doctor. But they are employing all members
Good.
of the team
Good.
to
Wow.
make these phone calls, so that they can free up, the people that are at that bedside front line. So, I can only speak for that facility, but I do think that many hospitals and even nursing homes and other facilities are doing their best to try to engage other members of the team to stay in contact with the family members.
That's wonderful. So I think, so yeah, so really focusing on like calling in several times a day, being an advocate. Can you talk a little bit about, there sometimes feels like a little bit of a battle between an advocating family and the physician,
Oh,
and
yeah.
your thoughts about that, and how that might be exacerbated, and what we can do as healthcare professionals, like from both sides, like I don't want to say provider, that triggers a lot of people, but as the person who's taking care of the patient, what should we know about the people who are advocating, and as the advocates themselves, how can we all understand each other better?
Yeah, I think thank you for that question. It's really important. I think historically, and I think a lot of this has to do with the healthcare system and the constraints that it puts on doctors and other healthcare providers. And, so we are intimately aware of the fact that we have a limited amount of time. And particularly if you're in an outpatient setting, where you have appointments. And so an empowered patient or an empowered caregiver can really kind of appear to throw your day off. And so they can, present as a threat. And I think personally, I'll just share this really quickly. Years ago, when my mother-in-law was critically ill in the hospital, and, this is before I was your GPS doc, I was just her daughter-in-law, and I happened to be a physician. But we had this family meeting that I actually called because things were just a mess. And it was clear that the doctors weren't really talking to one another, and she was literally dying. And during this meeting, as I'm asking questions and asking follow-up questions and advocating for, whether she needed to be transferred, a note was passed between two of the doctors. And I didn't see this happening, but after the fact, my sister-in-law pulled me aside and said, "What does high maintenance mean?" And I
Mm.
looked at her and I was like, "Why are you asking me that?" She said, "Well, while you were talking, one doctor wrote high maintenance on a piece of paper and passed it to her colleague." And I was just I was pissed off. I was
Oh my God.
sad. I had all of the emotions.
All of them.
But later, when I reflected on it, I had to acknowledge, have I used that word before? Yes. Have
Uh-huh.
I signed out to a colleague and said, this is a difficult patient? Or, I'm a pediatrician, so we usually say this is a difficult mom or a difficult family. And so, it really made me analyze my own actions. And so I think,
Mhm.
we as doctors and other healthcare providers need to understand that first of all, what if that was your family member? And I always have approached, when I was more active clinically, every pediatric patient that I took care of, I thought about it as, what if this was my child? And when and so I encourage people who take care of adults, what if that was your mom? What if that was your dad? You would want to be, you would be an advocate as well. And I think we as healthcare providers need to understand that, and we should want our patients and their family members to be involved, because ultimately that helps us. Yes, it may take up a little bit more of our time on the front end, but imagine, how much more compliant that patient will be. Imagine how much easier your future encounters, your future dialogue with that patient will go once you've established that trust, once you have empowered them to ask questions and to understand their condition. And so it really, a little bit of investment on the front end just goes a long way. And there are many studies that show that when, patients are informed, when they are educated about their condition, they are more likely to follow through with the things that we ask them to do. And so ultimately it's a win-win. You're going to have a healthier patient, a happier patient. They're going to help you do your job better. So I think, especially now, we have to embrace the idea that patients and their caregivers are not just like an afterthought. They really are at the center, or should be at the center,
Mm-hmm.
of the medical team, and that we all have to work together to make sure that, that the patients are getting what they need. So, going back to health disparities, I think unfortunately, most people of color, and even people that aren't of color, if they are in a lower socioeconomic status, or if they don't have a certain educational level, they are not as prepared to effectively advocate for themselves in healthcare settings. And so I think, that plays into, I know that plays into the healthcare disparities, because if you are not able, or if you're not empowered to speak up for yourself, then, you're just not going to even be offered some of the therapies that are offered to that difficult patient. Because no matter what we say, those are the squeaky wheel gets the oil.
Yeah.
And so if you don't have the tools to be that squeaky wheel, then what kind of care are you receiving?
Yeah. And I wonder, because a lot of the work I do is about recognizing your reaction to things. Like that's the whole basis of my anti-racism course, is recognizing your defensiveness and your discomfort and all these things.
Yes.
I wonder if there was some training we could do for physicians and other healthcare professionals of when you start to feel defensive about families advocating, if
Yeah.
that can be your cue to not close down and not blame them, but to really tune in and listen, because
I love that idea.
that's what happens. I think that's just human nature. You get challenged. You don't like to hear it. There's always a grain of truth in it.
Yeah.
And so what will often happen is you'll be like, no, like no twice as hard, and really shut down. And that barrier is even harder to break down. Can you talk about your 90-second
Encounter?
encounter and
Yeah.
what that is, and how you think that helps, and how you think that could help in COVID, and maybe you and I talked offline a little bit, what that means for the broader implication of healthcare disparities and discrimination.
Sure. Yeah. Thanks for asking that. So when I was caring for my dad, one of the things that really literally broke my heart is that I felt and saw that he was invisible. And what I mean when I say that, and I, part of it may have been that he was African American, part of it may have been that he was elderly, part of it may have just been, that he was a patient, and this is how we view patients. But I felt that many of the doctors and nurses didn't see my dad, and they didn't see my dad because they didn't know my dad. So my dad was, the patient in room 248, or my dad was, the hypertensive. And we all do this. I mean, I have called patients, the asthmatic,
Mm-hmm.
the sickler.
I was just going to say that. That's
Yeah.
the
I
worst.
mean, we say these things, and we don't
So
we
racist
don't
and bad
mean
and
it to
sad.
be disparaging. But when you see your patients by their condition or by the room number that they occupy, then they really become invisible to you. And so I made it a point to share information about my dad that really just humanized him.
Mm-hmm.
So the idea of the 90-second encounter is something that I talked about in my TEDx talk, where I feel like at the crux of the whole breakdown of our healthcare system, and even when it comes to physician burnout and depression, is a lack of genuine human connection. And, you know, the electronic medical record and all the other things that have forced us to kind of disconnect from our patients has really been a detriment. And so what I propose is that every doctor at the beginning of every single encounter, whether it's in the hospital, the ER, your private office, is that you spend 90 seconds, just 90 seconds, getting to know that patient on a personal level. It could be, hey, what's the best book you've ever read? Or where did you go for vacation last year? And, you know, if you're a primary care doctor, you actually have a relationship. Maybe you remember that the last time they were there, their daughter was getting married. And so in that 90 seconds, you say, hey, you know, I remember last time you were here, your daughter was getting married. How did it go? And it's just, it allows you to connect with that person. And it benefits the patient because you're seeing them as a real person and not just what's on their chart. But even as the doctor, you know, it restores that humanity to that doctor-patient relationship. And that's why most of us got into medicine in the first place. And so I believe that that also is like an antidote to, you know, burnout and all the other ills that are facing physicians right now. And so as it relates to healthcare disparities, I mean, it's so incredibly important because all of us, even myself as an African-American, you know, we all have biases that we have learned from, you know, since we were little, things that people in our lives have told us, things that we've seen on television. And so, you know, if you are walking into the room and you see, you know, a young African-American male who's dressed a certain way, and maybe his pants are, you know, sagging, you know, hanging down off of his bottom, you're automatically going to have these ideas about this person, and you're going to, you know, maybe devalue that person. But if you spend 90 seconds just talking to that person, you may be surprised. You know, he may be an author, he may be a poet, he may be a caregiver to his 90-year-old grandma. And when we, you know, connect with people on that personal level, it almost, it makes it so that you but it's less likely that your underlying biases are going to come into play, you know, and you're going to be more like you're human. The human in you is going to come at the forefront, and that's going to impact how you treat that person and the medical care that they receive. So I think it can literally be transformative in healthcare.
I love that so much. I remember a patient I had who was, she was a Black woman in her probably 40s or 50s, and she was a heroin addict, and she had multiple infections on her arms from injecting heroin. But she was the nicest, you know, like she was such a wonderful, kind woman. I found in general that like the heroin addict patients I had were all really nice. There's different places where I did my training had different types of drug problems and different of ways they affected the patient's behavior when they were intoxicated and stuff. But she was so sweet. And I remember I had like a patient who was a pimp, and I was like, okay, but you're also human. And like, we would, you know, like it just, for me as a med student, it was such this amazing education to actually like talk to people who were so different from me and see the common humanity. But you lose that so quickly in residency and beyond because you don't have the time. And it just is like more work for you to do rather than like, ooh, I have 2 patients that I'm following and I get to know them, and the joy of that gets lost very quickly.
That's exactly it.
So how do you see this needing to humanize people that happens outside the hospital too? I had conversations in an HIV clinic that I worked in. You know, like the people I work with there, they're like in the medical community. You kind of don't get more like do-gooder than that if you're working in an HIV clinic. I feel like that's like a strong team of people who really want to help.
Yeah.
And we were talking about police violence and, you know, the choking and the I can't breathe. And the guy I was working with, he said, yeah, but I mean, he was a thug. And I remember being like, that sounds weird, but I couldn't at that time put my, like, is he right? But it doesn't matter. You know, it's like life is still life. And I think that gets lost in the broader scope of things as well, not just in the hospital. And this might be more of a topic that we can take on in this interview, but seeing that people who are different from us are humans, having that 90-second of connection, even if it's silently in your mind without talking to, maybe you can talk to that person, but maybe it's someone that you just see when you're driving or you're in traffic or whatever. Can you talk a little bit about that and your thoughts on that? I know it's sort of a little bit of an offshoot, but
Yeah.
seeing the humanity in everybody, even if they aren't exactly like you.
Yeah. I mean, I think, it's definitely needed. I mean, I think the difficulty with that is that, when it's very hard for all of us to relate to people who are unlike us. And I think that, again, the biases that we've all been taught, and this is systemic, it's all intentional, the images. I mean, this is way beyond the scope of our
Right.
short interview. And I know you're familiar with this, but, just the images that are portrayed and how the African American community and other communities of color are portrayed, that is embedded and ingrained in the subconscious of America. And so, when you approach someone or when you see someone, whether it's in a medical setting or out on the street, that's different from you, all of those messages that you don't even know are there just come, flooding. And so it leads to, judgment. And, if you haven't been in that situation yourself, then it's really difficult to kind of understand. And I mean, that's really where empathy comes in. I mean, we really have to be able to put ourselves in other people's shoes, and just really try to dig deep and to understand why things are happening. So like, again, if we go back to the disparities, it's easy to blame African Americans, to say, you guys are obese because all you eat is, fried food, or all you eat is processed food, or you don't exercise. And, but if you have access to, a Peloton bike in your basement, like we're staying home now, right? So all the privileged people who bought the Peloton bikes, or people who have home gyms, they're doing just fine, right? Because they have access to that equipment, but if you are living in the inner city, even before COVID, and you don't have a safe place, you don't have a green space, you don't have a playground, you don't have a track, you don't have a gym membership, and all you have access to is the corner store with, chips and sodas and junk food. Or when you go to your local grocery store, there's very few fresh foods, and what's there is wilted and rotten. I mean, this is the reality for a lot of people. But if you haven't experienced that yourself, it's easy to just judge someone and say, well, why can't you be more like me, without understanding all of the barriers and all of, the, like, what their life is really like. So, I mean, I don't have all the answers,
Right.
but I think, as humans, we just have to try our best to, again, learn more about what other people are experiencing, and really trying to figure out, what would you do if you were in that same situation. Even as an African American female, like, I am intimately aware of my own privilege, especially during this COVID-19 pandemic, and the fact that I am blessed to be able to work from home. I haven't, my income hasn't changed. My kids are safe, and our home is big enough that we can all go in different areas of our home and not drive each other crazy. And many people don't have that privilege and that benefit. So I think, hopefully during this pandemic, when we're all forced to, be still, and, I say physical distancing, I don't like to use the word social distancing, but I hope that we are all taking that time to really be introspective and to just become better people. That's my hope. We cannot come out of this the same way that we were before. I mean, we have to do better. We have to be better.
It's a reckoning of sorts, it's really, it's very, very quickly, what is unsustainable is making itself very clear,
Yeah.
so yeah, I agree. So what can people, like you and me, who are privileged and at home, who look like either one of us or look different than either one of us, what can people do during this physical distancing time? And I just heard that term yesterday and I love it. It's so much better. what can people do to help? What can people do to learn? To address, I mean, we've been talking a lot about bias. I love how all these different conversations I'm having are so different, but to help, address their own stuff, but also help in the outside world explicitly now. What are your thoughts on that?
I think one of the biggest things people can do is to just acknowledge that we all have bias. I don't care whether you think you're racist or not, or, whether it's implicit, explicit, all of us have bias, and that's been proven in many studies. So I think that's really the first step, is to remove the defense that it's not me or I'm not part of the problem, and just to acknowledge and to really begin to examine, what comes to your mind when you see an African American teenager, or an African American woman, or what are the instant things that pop into your brain when you see the thug, as you mentioned earlier, and to just acknowledge that we all have those biases. And then in all of us can, even in our own homes, just begin to educate ourselves about the organizations that are in our communities and just outside of our communities that serve communities of color, whether it's making a monetary donation, whether it's volunteering, but just really kind of stepping outside of ourselves and, finding out what's in my local community, whether it's, in the school system, or whether it's the food bank, or whether it's a homeless shelter, just all of the resources. Because these organizations are struggling just like, all the other small businesses, and they're going to need monetary help. They're going to need bodies, and, when we're all back to normal. So I think just spending some time educating yourself. And for those of us, those of you or your viewers who are healthcare providers, again, I just really encourage you to examine your own biases, and to really just take the time to get to know your patients, particularly your patients of color, to really try to, spend a little bit of time understanding and learning more about their situation, and empowering them to ask questions, making sure that they understand the information that you have presented. Those techniques we learned in medical school, teach back, that none of us use anymore, but instead of just giving some instructions and walking out of the room, taking an extra 60 seconds to say, okay, what do you understand about what I just said to you? Just little things like that can go a really long way in helping patients and their caregivers advocate for themselves, helping them get the care that they need, making sure that they are equal partners is just really, really important.
Yeah, that's such a good point. And maybe even like an attitude shift when you find yourself getting annoyed at the advocacy, switching that to gratitude, like, oh, this is a human being that has somebody who loves them, that cares.
That's right.
Rather than this is a threat to my knowledge and expertise, and I'm the doctor here, and that, that horrible loop that a lot of that can happen in medicine. Like, how dare anyone question my absolute authority?
Yeah.
Oh, this is so wonderful. Well, thank you so much, Nicole. This has been really, really educational, and we kind of got into it. I feel like we really tackled some pretty major stuff. And of course, this is the beginning of the beginning of the beginning of talking about this, but really the humanizing of everybody, and realizing that in the hospital, outside the hospital, there's so much more that we have in common, and recognizing that our biases, and I love that you acknowledge that all of us have bias. I mean, and to pretend that we don't is a little bit insane, and I think acknowledging that and having that be our starting ground is, I think, a really great way for us to start. So I love what you had to say about that, and how people can reflect during this time as well. Can you tell us how people can find you, and if they're looking for a health advocate, how they can learn more about you? And I'll post the link to your TEDx talk and your websites and everything. But what do you offer people, and how can they continue to learn from you after this interview?
Yeah, so my website is www.yourgpsdoc.com. There are blog articles there, lots of tips and information about navigating the healthcare system. There's a contact page. So if someone's interested in working with me or just wants to learn more about how I work with individuals, you can always reach out to me there. There's a services page where you can see all of the ways that I help families and the individuals for whom they care. And then on social media, I would love for you all to follow me on social media. I have a weekly Facebook live show called Navigator Nuggets, where we talk all about how to navigate healthcare. For the last month and a half, every episode has been dedicated to coronavirus. And so my Facebook page is also, if you search Your GPS Doc, really on all social media, I'm Your GPS Doc. So on Facebook, on Twitter, on Instagram. You can find me on LinkedIn, Nicole Rochester. And I would love for you all to reach out to me. I would love to engage with you on social media and continue this conversation.
Your Navigator Nuggets are so good. That's what I saw on LinkedIn. I think you reposted it from
Yeah,
Facebook, and I
thank you.
watched like all 41 minutes. I was telling her before the show, like, it was so good. And I was just so, the way you're explaining these really complicated issues that can be very polarizing, and shut a lot of people down. I thought you just explained it in a way that was very accessible and compassionate, which, as you and I were talking about, I sometimes haven't found that finesse yet. So it's so good and so informational, so educational, and I loved your 3 nuggets at the end. So for anyone who watches that, make sure you stay tuned for that. So thank you so much. I hope you have a good weekend, and stay safe and keep doing all the amazing work you do. And thank you again.
Thank you. I appreciate the opportunity to talk with you today.